Panic attacks are episodes of intense and overwhelming fear or anxiety that can be accompanied by physical symptoms such as heart palpitations, sweating, shaking, chest pain, shortness of breath, and dizziness. Panic attacks can happen suddenly, without warning, and can last for several minutes to hours. They can be frightening and disruptive to daily life, making it difficult to engage in normal activities. During a panic attack, people often experience a sense of impending doom, feeling as though something terrible is about to happen. This can lead to avoidance of situations or places where panic attacks have occurred before, which can lead to a significant impact on their life, such as avoiding social events, public transportation, or driving. Panic attacks can occur as part of panic disorder, which is a type of anxiety disorder. Panic disorder is characterized by recurrent and unexpected panic attacks that are followed by fear or worry about having more panic attacks or the consequences of having a panic attack. People with panic disorder may also experience agoraphobia, which is a fear of being in situations or places where escape may be difficult or where help may not be available in case of a panic attack. Panic attacks can also occur in other anxiety disorders, such as generalized anxiety disorder, post-traumatic stress disorder, and social anxiety disorder. They can also occur in medical conditions, such as hyperthyroidism, heart disease, and hypoglycemia. Risk factors for panic attacks and panic disorder include genetic predisposition, environmental stressors, and other mental health conditions, such as depression or substance abuse. Treatment for panic attacks and panic disorder usually involves a combination of medications and psychotherapy. Medications used to treat panic disorder include antidepressants, benzodiazepines, and beta blockers. Psychotherapy can help people with panic disorder learn coping skills to manage their symptoms, such as cognitive behavioral therapy and exposure therapy. In addition to medications and psychotherapy, lifestyle changes can also be helpful in managing panic attacks and panic disorder. These may include avoiding caffeine and other stimulants, getting regular exercise, practicing relaxation techniques such as yoga or meditation, and getting enough sleep. It is important to seek help from a mental health professional if you are experiencing panic attacks or panic disorder. With proper treatment and support, people with panic disorder can learn to manage their symptoms and lead a fulfilling life. Panic attacks can be a debilitating and distressing experience. They can disrupt daily life and make it difficult to engage in normal activities. While panic attacks can be treated with medication and therapy, there are also some self-help tips that can be useful for managing panic attacks. Here are 5 tips for managing panic attacks. 1. Practice deep breathing and relaxation techniques. One of the most effective ways to manage panic attacks is to practice deep breathing and relaxation techniques. When you experience a panic attack, your breathing may become shallow and rapid, which can make the symptoms worse. By taking slow, deep breaths, you can slow down your breathing and calm your body. To practice deep breathing, find a quiet and comfortable place to sit or lie down. Close your eyes and take a slow, deep breath in through your nose. Hold your breath for a few seconds, then slowly exhale through your mouth. Repeat this several times until you feel more relaxed. Other relaxation techniques that can be helpful for managing panic attacks include progressive muscle relaxation, where you tense and then relax different muscle groups in your body, and visualization, where you imagine a calm and peaceful place. 2. Challenge your thoughts. Panic attacks are often triggered by negative thoughts and beliefs, such as, "I'm going to die," or "I'm losing control." These thoughts can fuel the panic attack and make the symptoms worse. To manage panic attacks, it can be helpful to challenge these negative thoughts and replace them with more realistic and positive ones. For example, if you find yourself thinking, "I'm going to die," challenge this thought by asking yourself, "Is this really true? Have I ever died from a panic attack before?" You can also try replacing this thought with a more realistic one, such as, "This is just a panic attack, and it will pass." 3. Create a self-care plan. Self-care is an important part of managing panic attacks. Creating a self-care plan can help you prioritize activities that make you feel good and reduce stress. Your self-care plan might include activities such as exercise, spending time with friends and family, practicing mindfulness, or engaging in a hobby you enjoy. It's important to make time for self-care activities regularly, even when you're not experiencing a panic attack. 4. Identify and avoid triggers. Panic attacks can be triggered by specific situations or activities. Identifying these triggers and avoiding them can help you manage panic attacks. Common triggers for panic attacks include crowded places, public speaking, driving, and certain smells or sounds. If you know that a particular activity or situation triggers your panic attacks, try to avoid it or approach it gradually. For example, if you experience panic attacks while driving, you might start by practicing deep breathing and relaxation techniques in a parked car before gradually driving short distances. 5. Seek support from others. Managing panic attacks can be difficult on your own. Seeking support from others can help you feel less alone and more empowered to manage your symptoms. You might consider joining a support group for people with panic attacks or talking to a trusted friend or family member about how you're feeling. You can also seek support from a mental health professional, such as a therapist or counselor, who can help you develop coping strategies and manage your symptoms. In conclusion, while panic attacks can be distressing, there are strategies that can help manage symptoms. These tips, including deep breathing and relaxation techniques, challenging negative thoughts, creating a self-care plan, identifying and avoiding triggers, and seeking support from others, can be helpful in managing panic attacks. It's important to remember that everyone's experience with panic attacks is unique, and what works for one person may not work for another. If you are experiencing panic attacks, it's important to seek professional help and develop a personalized plan for managing your symptoms.